When patients come to see me with a joint problem, they've usually started treatment on their own. They've tried to lose some weight, they've modified their activity, they don't walk up that hill anymore, they use the elevator, they stop running. And then they've gone to their primary care physician, who's probably started them on an anti-inflammatory, a prescription, and they're coming to see me because that hasn't worked. I will always work through other options with them: bracing, physical therapy, injections, maybe a different anti-inflammatory. But for most of the patients that are referred to me, surgery is the next step. How to decide the timing of surgery really depends on your symptoms and your function. Basically, when a knee or hip is so bad that it's controlling every decision you make every day, it's time to think about getting the surgery done. The age range for total joint replacement is from 20 to over 100 years old. The average patient in the United States is about 62 years old for getting a joint replacement. But what they all have in common is a lack of function. Even the most simple things that we take for granted every day: getting dressed, getting in and out of a car, climbing up and down some stairs, carrying one or two shopping bags, becomes extremely difficult for them and extremely painful. That's what they have in common.